with confirmation this week from the Reserve Bank Governor that interest rates are set to continue to rise for quite some time to come, more and more Australians are likely to be experiencing increasing pressure making ends meet, and it's most often during times of stress that our health can take a battering too. So how can we avoid financial stress causing us potentially damaging mental and physical stresses too? Now, clinical nurse consultant in pain management, Clair Dunkley, joins me this morning to talk about this subject. Good morning, Claire. You've been working with patients and clients experiencing serious pain and injury for over 20 years. And when you break it down, you say many of them have done themselves damage during stressful periods.
Yeah, good morning, Tim. So I don't want to alarm your viewers, but stress is the leading cause of disease in our modern world. So it's directly linked to the 6 biggest killers, which is cancer, heart disease, liver disease, lung disease, accidents, and suicide. So how does it do this? Well, stress causes our nervous system to become inflamed, and that inflammatory process then spreads throughout our entire body, affecting every cell and every system. And the number one cause of stress, Tim, unfortunately, is financial problems.
Well, let's talk a bit about that hidden inflammation, because this really is your specialty. What are the telltale signs that people can look out for and hopefully nip in the bud before they flare up further?
Yeah, it's a great question, Tim, because what we find here in the clinic is that the clients that come in with this hidden inflammation have had all the tests, they've had their CT scans, they've had their MRIs, they've had all the blood tests, they all come back normal. So our clients are told that there's nothing wrong with them, that it's all in their head. But it's not normal to wake up with headaches or aches and pains or stiff joints. It's not normal to have diarrhea 1 minute, constipation the next, or have anxiety or brain fog or fatigue or skin issues. Like, there are so many signs of this invisible inflammation. And the thing is that if it goes untreated, then diseases, like we mentioned before, show up 5, 10, 20 years down the track.
Now, prevention is obviously better than a cure, but importantly, it's all about not suffering in silence. If you do notice you're in pain, what are some of the treatments that are available?
Yeah, well, first off, you need to not be self-medicating. Like, we get into a pattern during these times of self-medicating with alcohol or drugs or something like that. That just adds to our burdens, health-wise and financially. So please stop that pattern. But here in the clinic, we specialise in ANF therapy, that's amino-neurofrequency. It's designed to keep your nervous system calm, therefore the inflammation doesn't start and doesn't spread throughout the whole entire system.
You will tell us a little bit more about that therapy and some of the results of that big global research study.
Yeah, well, ANF therapy, as I said, stands for amino-neurofrequency. It works on the frequency within our body. So what does that mean? Well, we've all had an ECG or seen the ECG, which measures the frequency of the heart. Well, every single cell in the body has that frequency. Now, the health professional that you see that uses ANF therapy, whether it be a doctor, a chiropractor, a nurse, or an osteopath, a physiotherapist, we are all trained to see the signs of invisible inflammation, the signs that your frequencies within your body are damaged. And then we apply the medical device, which looks like a little sticker. We apply, for example, on our thyroid to make sure that our thyroid frequencies are working perfectly and that our nervous system stays calm and the inflammatory process does not begin.
And there are also some really simple, free things we can all be doing during stressful times to bring down our stress levels and prevent inflammation. What are some of your tips?
Yeah, well, it's simple and easy. We teach our clients here in the clinic to go out barefoot on the ground, just like Richard Gere did in Pretty Woman, Tim. He took his shoes off, he got out on the grass when he had some, big decisions to make, and he was calm, and it gave him clarity of thought. So we encourage our clients to do that. If you don't have a backyard, go down to your local park. And also breathing, just simple breathing exercises keeps the oxygen coming through our system. It keeps the nervous system calm. And I also encourage people to create community. Like none of us are in this alone. We are all under this financial pressure. So go and knock on your neighbour's door, find out how they are, what they need. And as a community, we can band together and help lessen our costs by mowing each other's grass or walking each other's dogs, or, you know, having a communal cook-up. Just simple things like that can really slow down the impact that this kind of stress has.
Yeah, and even sharing the issue, you know, what they say, a problem shared is a problem halved. Now, your practice, finally, Clusie Clinic, is based on the beautiful Sunshine Coast in Queensland. How can people get in touch with you, make an appointment? Of course, we're in the world of Zoom appointments and everything else. Tell me more.
Yep, so the easiest way to find us is via our website at clusie.com. That's Clusie with a Z-I-E. And if you're not fortunate enough to live on the Sunshine Coast, I can do telehealth appointments, but there are ANF therapists throughout the country. And if your health professional doesn't know about ANF, then get in contact with us, because I'm one of the instructors worldwide and I can bring ANF to you.